Some promising news on the horizon for some patients with lung cancer. Dr. Edward Guerin is with the UCLA Johnson Comprehensive Cancer Center, and he joins us now. Thank you so much for being with us.
Thank you very much for having me.
So I want to start out with the basic numbers. How many people are actually affected by lung cancer in the United States?
Annually, about 200,000 cases of lung cancer are diagnosed. And although there is a percentage of patients from that 200,000 who have what we describe as localized disease for whom they are amenable to surgery, unfortunately, most people present with disease at a later stage of disease at a time when things like surgery are not necessarily the appropriate option.
And what are the different forms of the disease?
So about 15% of patients with lung cancer have small cell lung cancer. And what that means, of course, is that the majority of the patients, the 85%, have what is described as non-small cell lung cancer. Non-small cell lung cancer is made up of several different groupings. And over the last several years, it's become clear that in many cases, that there are specific mutations that are present in a patient's tumor. And these mutations, in fact, drive the clinical activity of the cancer and can also be vulnerabilities in terms of treatment. And so these are not inherited mutations. They're not something one gets from a parent, but they're present in the tumor and are integrally involved in that tumor being cancerous. It's very important that a patient knows what these mutations are as they make decisions on their treatment approach. There are really quite different treatment approaches based on whether or not a patient has a specific mutation targeting that can be targeted by drugs. And in some respects, that's because we do now have drugs that in many cases are able to target the specific mutation that is present in a patient's tumor. And although each patient is different, in general, we have found that when patients have received therapies that are targeted against their tumor, as opposed to standard chemotherapy-based approaches, that the targeted approaches have been really, one, more effective, and two, less associated with toxicity.
One of these drugs is called Tabrecta, I believe. Can you tell us a little bit more about that?
Yeah, so this is I think the newest of the targeted therapies that was approved, and is the first therapy approved for patients with abnormalities involving the MET gene, M-E-T. And MET has been studied for decades as an important gene in cancer and lung cancer. But up until this approval, there have not been any therapies specifically directed against MET. We know that about 4% of patients have what is described as a MET exon 14 skipping mutation. And what was shown in a recent clinical trial is that in patients who have this specific mutation, that they were quite effectively treated with this drug, and that a large number of those patients had significant shrinking of their tumor, and that was generally a good duration. In addition, the drug was in general well tolerated. It was not associated with the typical chemotherapy side effects. This is not a typical chemotherapy. It's what we describe as a targeted therapy. And for patients who did have toxicities, the most common was lower extremity swelling. In most cases, it was fairly mild. And in cases where it was more significant, it responded to either holding the drug or reducing the dose. There's data available on the US FDA website, as well as the website of the drug's manufacturer, which is Novartis Pharmaceuticals.
All right, Dr. Guerin, thank you so much for being with us. Really appreciate that. And we'll be right back with more Midday Maryland right after this. Stay tuned.